Good morning, everyone. Thank you for joining to discuss a topic today that's at the forefront of everyone's minds, especially those of us who work in the healthcare industry, and that is our state's ongoing shortage of healthcare workers. My name is Dr. Mark Bloom. I'm the Chief Medical Officer for Molina Healthcare of Florida, where I've served the people of Florida in the past 13 years in this role. Here at Molina, it's our honor to provide Floridians with top-rated healthcare options. Through our work, we also understand the challenges that healthcare professionals face in delivering care and delivering care across our state in the face of barriers like the topic we're going to discuss today. As part of the Molina Cares Accord, our community investment platform, we're presenting this virtual panel addressing healthcare workforce shortages in Florida to convene a thoughtful discussion about where we are and the innovation and the future investments that can help bolster healthcare capacity to meet the needs for now and in the future. Before we get started, I wanted to note a few administrative items. We are recording today's event and we'll be posting it online at molinacares.com. We encourage you to share the recording with interested parties who couldn't join us today. All participant lines will remain muted, and attendees are encouraged to submit questions through the Q&A or chat feature, and we'll do our best to group similar questions and ask our panelists for their thoughts if there's time before the end of the hour. Now back to our topic for today. As Molina's Chief Medical Officer, I've seen tremendous improvements in technology and quality of care led by the amazing men and women who put patients first during the challenges of our recent pandemic and in their daily work. But attrition and turnover are leading to a historic shortage in our critical healthcare workforce, as I think we all know. As more people move to our state and as our population continues to mature, the need is great. Before we turn to our esteemed group of panelists with much to offer on this topic, it's my pleasure to introduce a very special guest who will kick us off. And that guest is State Senator Jay Collins, who is actually an American hero. Senator Collins, who now lives in Tampa, served in the United States Army for more than 20 years, including time as a member of the Army's Special Forces. He was deployed as a Green Beret in Afghanistan, Iraq, and South America. In Afghanistan in 2007, Senator Collins was hit in the arm, but continued fighting and, believe it or not, helped perform surgery on himself during battle. A few months later, he again suffered combat-related injuries that eventually led to the loss of his leg. He kept going and served 5 more years in active duty as a deployable Green Beret. Senator Collins has held many roles during his service, including as a member of the Special Warfare Medical Group. As a combat medic, he delivered babies and performed life-saving medical operations on the battlefield. His public service did not end when he retired from the military. As a state senator, he is already leading in areas including healthcare to make sure Florida has the workforce we need to remain the best state in the nation to work and live. During the 2023 legislative session, along with Representative Tracy Coaster, they spearheaded a bill to address occupational licensing reform, which would ensure that people coming to Florida would be able to keep their license to practice in their fields as long as they are in good standing in their respective state. The measure would also apply to military service men and women. It is truly my honor to introduce Senator Jay Collins to hear more about his efforts to address the workforce shortages. Senator Collins.
Dr. Bloom, thank you. I appreciate it. And thank you so much to Molina in general for all that you do in our communities, all that you did during the pandemic, as you mentioned, to keep us safe, but more importantly, what we're all going to do together for the great state of Florida. So you did mention a little bit about my background, and I've got to say I was so blessed and honored to have been a small part of such an amazing community. We were afforded opportunities to overcome, adapt, and make a difference both here and abroad. And many of the things that I hope to bring legislatively to the table were honed and developed and created, right there through the special operations community. So you did talk about some of the things with the surgery on myself and losing my leg. But what I want to talk about, and I think it's really going to kind of jump to question 3 that I was given to focus on, what is it that I learned in the military that makes such a difference legislatively and helps prepare what we're going to do to solve the gap of healthcare? And it goes back to the public-private partnerships. Having seen a thing or two, I learned a thing or two. And it was incumbent on me to solve those problems, both for our current generation, but more importantly, educationally, how we created Green Berets and how we trained them for what was next. So we worked with Duke, UNC, West Virginia University, and many others in a public-private partnership to better solve what were the gaps in our healthcare. I was requested to come into a room and they sat me down. They said, Jay, we have a problem. We're losing people on the battlefield in austere places, and we don't know how to solve that. We want you to build the program to do that. That's a pretty big problem. When we had people, passing away in Niger or Chad or places around the globe because they were there by themselves without healthcare. And in doing that, we didn't know where to turn. So we turned to people like you, the experts. How would you solve this? How could we solve a problem in a remote space? And what we realized is we didn't have the infrastructure, we didn't have the capabilities, nor do we have the training, but we knew that we had to do it quickly. So we quickly developed a curriculum to take critical care and flight paramedic and apply it to what we did as Special Forces medics. And then we created a method of care for our non-medical personnel to solve problems at the point of injury. And what that became was a white paper for the DoD, the Trans-Regional Medical Network Strategy. And it was very simple. And this is the point I wanted to get to. If we don't have them in inventory and we can't draw them in, then we have to create them. Now let's jump ahead to where we find ourselves here in the state of Florida. And you mentioned what Tracy Coster and I worked on. And it's extremely important to focus on this. We're in a position, especially in the healthcare community, where we don't have enough providers in rural areas, in certain areas throughout, Tampa Bay, even Orlando, Jacksonville, within the cities. And we know that we can't create enough of them, especially in the dental community right now, to solve those issues. So we have to draw them in. And when you really look at what's creating the problem in drawing it in, it comes down to licensures. It's very simple. We have the government in the way. I will tell you, we had dozens and dozens and dozens of calls from providers around the country who want to come to Florida because of our economy, because of our ability to do fantastic healthcare in the way we're empowering our providers, but the licensing bodies wouldn't get out of the way. What we found with this universal licensure approach that we're looking at is it could bring up to 500,000 new licensures to the state of Florida, a 75% increase within DOH by itself. That's amazing and significant. But one thing that we learned through this process is we've got to get it right. We can't just say, hey, lock, stock, and barrel, everyone's going to come in. It's about maintaining our standard of care, making sure that the reputation that so many of you have built in our communities is maintained and, frankly, amplified, that we draw the right people in. And how do we do that? So we worked long and hard this session. We got so close. It got just to the finish line. It passed in the Senate and the House as far as through the committees, and we just couldn't get it over the floor. But I will tell you, we are spending the next several months focused on DOH, focused on DBPR, and really fine-tuning this messaging to solve those problems legislatively. So what it's going to look like is no carve-outs. We want to draw people in from all bins of industry, from our nurse practitioners to our MDs, our nurse anesthetists, our dentists, and even off into the DBPR realm. And with that, we're going to need people like Molina, like you, Dr. Bloom, subject matter experts to sit down with us and tell us, what is it that's critical? What are the things we need to establish as the line in the sand? If you don't meet this requirement, you can't practice in the state of Florida. And then we have to get that in legislative, in writing, through drafting and on the table, so we can really start having those hard conversations. One thing I've learned through this process is it's not about me, it's about we. I can't do it without you, and I'm so grateful that you guys have been there along the way. This is just one piece of it. If we can draw more people in, then we got to push them out to rural communities. And I know this is something that I've spoken to Molina about several times, as well as other organizations. This isn't going to solve all of them. We're going to have to incentivize people to get out in those communities. And I think that's something else legislatively that we're looking at. And I'm hearing that this is going to be a big healthcare session upcoming, and I'm so grateful to have a partner like Molina and people that frankly care so much about our communities to be a vibrant part of solving this problem. So I'll leave you with this. You know, my first lesson as a Green Beret was from a well-traveled gentleman who looked like he was 76, but was probably 32. And in this, 1980s Pall Mall voice, he said, son, if you don't do anything else, you got to leave things better than you got it. And truthfully, with the way Molina works, with the way our legislation is pushing things, that's what we're going to do. But it's not about us. It's about ensuring that our children and the children that to be have the opportunity at the best healthcare and the best life here in the free state of Florida. I'm so grateful for the opportunity, and I wish you all nothing but the best. And I'm going to go on mute because I was told not to talk too long. Y'all have a good one. God bless.
Thank you very much, Senator Collins. I applaud those efforts for sure. I mean, we at Molina certainly see the need, especially in the rural areas, as you mentioned, trying to find providers for our members. So thank you for that. And thank you for your efforts to assist Floridians in healthcare in general. And on the panel side now, I'd like to get other views because the current shortage is leading us to a true crisis, as I think we all know, where quality of care is actually being threatened by the shortage of providers, especially in the more rural areas, as you just mentioned. It's estimated that our state will have a shortage of about 59,000 nurses by 2035, due in large part because of a 32% turnover rate in the profession. Healthcare providers are adapting with salary adjustments to keep pace with inflation, more use of technology to reduce the administrative burdens, and increasing the partnerships with colleges and universities to train more nurses. There's not one simple cause, nor is there one simple solution, I think, as we all know. The Florida Healthcare Association, which represents long-term care facilities that care for Florida seniors, are also facing a huge workforce shortage. In fact, about 92% have said they are facing staffing shortages. 74% were forced to close or were forced to use temporary staff through an agency to fill some of their shifts, rather. And more than half of the state's nursing homes have had to reduce admissions because of the staffing shortages. There's been a commitment among diverse fields to reverse these shortages before it becomes an even deeper crisis. There's been leadership from Governor DeSantis, who awarded $80 million earlier this year for high-performing nursing education programs in the state to help with scholarships, equipment, and faculty. We have great public servants in the legislature who, like Senator Collins, are committed to finding solutions, as you just heard. As we have some of the best minds in the medical field in Florida today, some of whom have actually joined us now as our panelists. The first one is Kristen Knapp, who's the Senior Director of Strategy and Communications and Workforce Liaison for the Florida Healthcare Association, where she manages a federal grant to fund the Caregivers Florida Career Program to attract more CNAs into long-term care. We also have Dr. Michelle Canale, who's the Assistant Dean of the Nurse Anesthesiology Program at the University of South Florida's School of Nursing, and is a leader for the state's professionals in this critical field. Along with her colleagues, we have been working on innovative programs to make sure that Florida recruits and retains nurses who graduate from Florida's nursing programs. We're also happy to welcome Dave Sobish, a certified economic developer and director of the research for the Florida Chamber Foundation, where he has led a holistic look at the employment levels needed for our state to continue to thrive. On behalf of Molina, we thank each of you for all you do to make sure that each Floridian has the opportunity to thrive and follow their dreams. It's my pleasure to turn this over to our moderator today, Christine Sexton. Christine is Florida's leading journalist on the topic of healthcare, and her work with Florida politics, along with her Diagnosis Healthcare focused newsletter, is a must read for anyone with a desire to understand this ever-changing field in public policy. Christine, thank you for your time today.
Hi, thank you. And I want to take this opportunity to not only thank you, but also thank Molina Healthcare of Florida and Molina Healthcare Accord for enabling us to have this discussion today. I've already learned a lot, including that I'm going to have a very busy legislative session next year. I'm looking forward to learning a lot more from our panelists. So thank you. I guess my first question is to Dave. And I guess that is how significant we keep hearing about the healthcare workforce and that it's in a crisis. Can you share with us really how significant that crisis is today?
I appreciate you mentioning the 2030 blueprint, because it is the document that guides all of the decisions we make at the Florida Chamber Foundation. And that's the goal to grow Florida's economy to the 10th largest in the world by the year 2030. We can't wish our way there. We have to plan it. And so the 2030 blueprint has those 39 goals, one of which is ensuring that each of our employers has access to the talent they need at the time they need it. And when we look at the healthcare occupations in the healthcare industry, the data is certainly showing a marked crisis within the state of Florida. We're fortunate through some data products provided by the Department of Economic Opportunity that we can examine open job listings, so what employers are looking for live in the marketplace. And last month, there were roughly 460,000 open jobs in the state of Florida. That's a large issue. We're not going to grow our economy if employers can't hire the people they need. And among those, I'd say that there were around 65,000 open jobs in the healthcare industry, led primarily by registered nurses, of which, registered nurses are the number one open job in the state of Florida. Always have been, always will be. Well, hopefully not always will be, but it's like RSC, LN, and E on the Wheel of Fortune. You could wake me up and I would be able to say, without any doubt, registered nurses are the number one open job. But we also see that there's about 6,300 medical and health services managers positions that need to be filled. About 4,000 LPNs and LVNs. And some of these are likely to be undercounted because it's one organization, that has a job listing out there. It looks like one job listing, but it's actually representing multiple positions that they need to hire. And it's not just limited to those. When we dive through the list, if you look at the top 20 STEM-related occupations, and every healthcare job is a STEM-related occupation, 11 of the top 20 are in healthcare. So it's certainly a marked crisis within the state of Florida.
Huh. Yeah. I had not known that RNs had always been, an open, that the state's always been in need of them. That's interesting to learn. I have a question for Dr. Canale. What gaps are you seeing in terms of nursing needs and current enrollment?
Well, we're actually seeing an increase in highly qualified applications to the USF nurse anesthesiology program. However, we've been unable to increase our enrollment until very recently, and that's due to a shortage of nursing faculty. That seems to be the rate limiting step. The need for advanced practice nurses, including certified registered nurse anesthetists, is outpacing supply and is forecasted to continue to do so for many years to come. So it has been a very important goal for us to work toward increasing our enrollment. And we were recently able to add 10 learner seats per year, which is about a 20% increase in enrollment for our program, making us one of the largest programs in the country. So we're working hard to try to help answer the call for more advanced practice registered nurses and certified registered nurse anesthetists. The College of Nursing received one of the largest sums of funding from the Florida legislature this past session due to the performance measures of our College of Nursing. So we're also working hard at increasing the undergraduate RN numbers as well. So that's been very helpful.
Quick follow, how much was that? You said you received the largest amount. How much was that?
We received about $40 million just for the USF College of Nursing out of that entire budget. And that it was rationed based on performance and merit. So we're very proud to have received that. And the dean is hard at work increasing our numbers as we speak. So we are right on track. And I think we'll see, a big result from this, a big positive result in the number of RNs that we're able to produce.
Great, thank you for that. Kristen, I'm not too sure I see her on the panel yet, but Kristen, to me, long-term care is is unique, the different environments we have, but can you share with me, what are you seeing in long-term care? What shortages are you seeing in long-term care specifically?
Sure. Thanks, Christina. Thanks, Molina, for putting this together. Nursing homes are no different from other healthcare sectors in terms of the workforce challenges that we're experiencing. I think for our state, what makes us unique is our growing baby boomer population and the number of seniors that are continuing to come to the state. We really need to make sure that this is an area that we address. COVID really made a significant impact on our sector. So many nurses left the workforce from burnout. We were already seeing some that were retiring or nearing retirement, and they just made the decision that they had enough. So we've been working really hard with our partners, with educators within our own membership, our nursing homes, to not only try to attract new workers, but retain our existing workers through unique solutions. The legislature has done a great job in terms of helping to come up with some, different positions. The personal care attendant program, which is really creating a pipeline for people to enter into the long-term care profession. This past session, they passed the qualified medication aid, which another opportunity for an experienced certified nursing assistant to earn, take on more responsibilities after significant training, and then earn a higher wage and hopefully enter into the nursing profession. But, like Dr. Canali mentioned, there's a lack of educators really to train new nurses. And we see that in our own care centers. And it's really affecting our ability to try to recruit and bring folks in. We've got a very complex population that we serve in our nursing centers. So we need that skilled nursing care. And so it's a problem, and, but we're working through, legislative policy, through some of the federal grants that we can talk about later, to try to address that.
Great. Thank you. I would like to go ahead and take an opportunity just to remind people, participants, that please feel free to send in any questions you may have via the chat, and we'll get to them as we can. So thank you. But I have a second question for Dave. Dave, how do shortages measure up against other professions in the state? How do the shortages in the healthcare arena measure up to other professions?
Sure, that's a really good question, and I say it's a really good question because I've prepared an answer for it. And so, what I'd say is that we track a lot of metrics related to the Florida 2030 blueprint on thefloridascorecard.org, and so a lot of the data I'm mentioning here, participants and viewers can see it for themselves and also drill down to their county. So the backdrop for all of this discussion related to healthcare is that it's not simply a healthcare crisis in terms of workforce. We have a extraordinarily low unemployment rate here in the state of Florida, 2.6% at the moment. That compares to 3.6% at the national level. In the state of Florida, for every 100 open jobs, I talked about, the numbers of jobs within the healthcare industry, being somewhere near 65,000. For every 100 open jobs in the state of Florida, there's only 61 people looking for work without a job, right? So you can only shuffle things around so much. So we've got a gap between the amount of available workforce and the amount of jobs employers need to fill. And again, we're not going to reach our goal of being a top 10 economy unless employers can, fill all the positions that they need. So I mentioned that healthcare occupations account for 11 of the 20 top 10 STEM occupations. When you dig into the stats and you look at all occupations, so not just the science, technology, engineering, and math, you look at all occupations, healthcare is only 2 of the top 20. So there's certainly other industries that have a need for, workers and have jobs to fill, not just healthcare. But I would posit that a shortage of waiters and waitresses or retail sales clerks, which are 2 very large open job within the state. We've got about 15,000 open retail sales jobs. We've got 10,000 customer service rep jobs need to be filled, and we've got 6,500 waiter and waitress jobs that need to be filled. I would say when those jobs aren't filled, lines are longer. You may see empty tables in a restaurant and say, why do I have to wait? It's an inconvenience to consumers. When healthcare jobs go unfilled, it is, as Dr. Bloom said, it begins to affect the ability to deliver consistent quality of care to all Floridians in need of care. And when we take a little bit of a peek forward and we talk about where the economy is going and where population is going, and Kristen mentioned it in her remarks, we're expecting 2.9 million more people in the state of Florida by the year 2030. We're also going to expect in the year 2030, 40 million additional annual visitors. We'll have around 180 million visitors to this state in the year 2030. That's 500,000 people waking up in Florida every day that don't live here. So all of those folks have the potential, to need health care as well. And a lot of the growth and a lot of the visitation is going to be concentrated in the state's urban areas. We've seen that in terms of sheer numbers. But there's also the strongest growth rates we're seeing in the suburban and exurban or rural areas of the state. So there's both kind of a change in numbers and just sort of a change in order of magnitude that will be felt throughout the state, much in line with what Senator Collins said earlier.
Interesting. Dr. Kennelly, in your opinion, what are some of the causes of the current shortage that we're experiencing?
Well, I agree with what Dave said. There's a mismatch between the number of people coming into the state and the number of workers filling positions. So that's part of it. And while the need for nurses is increasing, so are the salaries for registered nurses and advanced practice nurses in the clinical setting. But in the academic setting, salaries for faculty really lag behind that of clinical nursing positions, which makes it increasingly difficult to recruit nursing faculty. So it's sort of like a negative feedback loop, and that's not sustainable. I think it's important for stakeholders to work towards staying current in the market forces and allowing for competitive salaries for nurse educators, given the rapidly changing economic landscape.
Interesting. And well, if we have time, I'll ask a follow-up. I'm not too sure people understand how many nurse educators it takes or what level of degree someone needs to be a future educator, but maybe we can circle back around to that. Question for Kristen: are there unique needs for long-term care residents that aren't being met today, because of this shortage?
Well, for our nursing centers, we have, for your audience, we have what's called mandatory staffing ratios. We have to have a certain number of staff to care for each resident per day. And, it's not so much that the needs aren't being met, but the access to care is limited because nursing homes, they can't take in new residents if they don't have enough staff to properly care for them. And what that could mean for someone is, either you aren't able to leave the hospital, there's a backlog because there's nowhere for you to go, or you might have to go somewhere that's outside of your community, farther away from your family. Particularly, we talk about, in the rural areas where there may not be many nursing homes in that county, you may have to go farther away. That makes it difficult because we know that when families can visit, that improves your quality of life. The other challenge that we see is that facilities have had to staff up using temporary agency staff. Now, we are trying to get away from that because we know that having our own permanent staff really makes an impact on quality. You have consistency of care. They get to know the residents' likes and dislikes. You're meeting with that same person. The staff become their family. And we have seen some of that leveling off in our certified nursing assistant positions where facilities aren't having to rely so much on that temporary staff in a CNA position, but for our nurses, because there's a shortage, we are seeing that, they may have to rely on more, there's traveling nurses, and all of that then affects, from an economic standpoint, you're having to pay more for a temporary staff than you would your permanent staff. So there's a factor, I think, to say that it's not so much that the needs within the facility aren't being met, but you're not able to meet the needs of your community if you have to limit access to care.
And to your point about nursing staffing, I know that when I listen in on the governor's long-term care excellence meeting, some of those facilities that are, vying for that gold star recognition, one of the questions the panel always asks the nursing homes are, how heavily do you rely on, nursing agencies? And it seems to me a lot of them that are vying to be the best, they pride themselves on saying that they don't, that there's a recognition that they don't want to do that because that familiarity makes a difference,
Right. And I would say that for all of our facilities, having your own staff is certainly, better for the residents. It's better for the culture, the team environment than relying on temporary staff. So all of us are working towards that. The
Sure.
challenge is, there's just not enough people out there that are applying for those jobs that are available to take those positions. And when you're competing against your fellow nursing homes, you're competing against hospitals, home health, there's only a limited labor pool to tap into, unfortunately, in our healthcare space.
Well, let's see if Dave has an answer for us about how we can try to get more people into the healthcare space. I guess I'm wondering, what direction are things going for the future? Are things looking good?
I think there is some promise. We've heard some of the promising practices, from the real healthcare experts here, and not the sort of economic demographer on the panel. And what I'd say is that the demand is going to continue to increase for healthcare workers. Kristen mentioned it earlier that Florida has an aging population. You can measure that by things like median age and other things. One way that we measure it is by the components of population change. And one sort of maybe inauspicious number one ranking for the state of Florida is that we rank number one in what demographers call the net natural decrease of the population, which is the situation when deaths outnumber births in the state. So that's an indication of, the demographics and the age profile of the state. We have roughly 90,000 more people, 90,000 fewer people being born than the other way around, which ranks us number one. Pennsylvania is number two at 56,000. So we do have that demographic challenge to figure with. And I talked about, the 2.9 million more people. I talked about the need to grow the economy. We are growing the economy. Florida's economy in the last 4 years has grown roughly double that of the United States as a whole when you measure it in real terms, adjusted for inflation. And I talked about the visitors, and I talked about all those things. Just to keep pace with the economic needs of our state, we're going to need to create 1.44 million net new jobs in the state, and many of them are going to need to be in healthcare. So, I might want to just think a moment or two about, the best ways to, offer some solutions. I think, again, we've heard some of them in terms of increasing the supply, but there's probably ways you can also reduce the demand.
Thank you. I'm going to ask a similar question of Dr. Kennelly. What can we do to continue to attract students to become the healthcare workers that we need?
I think we have to capitalize on our strengths. And right now, there's more stability in a career in nursing than ever before. Additionally, there are so many different career pathways in nursing, from bedside nursing to administrative roles to various advanced practice nursing specialties. And there's a need in every area. There's also an abundance of opportunities for career advancement and upward mobility in a nursing career as well. But attracting students to become nurses is a lot easier than keeping them in Florida once they graduate and become licensed. So I think it's important in order to address the healthcare crisis here at home, we have to do better at keeping our nurses in Florida.
Well, a quick follow. Why is that so difficult? I hear that. I know you're coming at it, wearing your nurse's hat, but I hear the same thing about physician residents. You want to build residency programs here because if you educate them here, they should stay here. But why are we educating advanced nurses, and why are they leaving Florida? What's going on there?
Yeah, so it comes down to the state statutes in Florida being more restrictive than in many other states. Nurses, when advanced practice nurses like CRNAs and APRNs, they want to go practice where they can work to their full scope of their education and training. So personally, in the nurse anesthesiology program, we're seeing about 25 to 30% of our students leaving after graduation to go practice in other states where they can work to the full scope of practice and the full depth and breadth of their education and training. So we saw last year in the legislative session, House Bill 607 gave advanced practice registered nurses who are doing primary care full practice authority, but the nurse anesthetists were carved out at the very end. I heard Senator Jay Collins say in the beginning of this session that we have to stop these carve-outs and we have to reduce the barriers. That is this is going to be a multi-pronged, endeavor. And that is a big part. We can educate all the nurses we want. We can throw money at, these educational programs, but we've got to keep them here.
Are we seeing the retention among the nurse that wants to stop at the RN level and not become a CRNA or go beyond that? When we're educating RNs and licensed nurses, are we seeing them? Well, I know USF is graduating RNs. Are we seeing the RNs stay in the field?
I don't have specific numbers about that, so I wouldn't want to misquote that. But
and I'm sorry, I know that caught you off guard, but I was just curious.
That's perfectly fine. I wouldn't want to misquote it, so I can't answer that question. But I do know that from an advanced practice nurse standpoint, which, the bedside nurses are obviously very critical and absolutely necessary. Advanced practice nurses, are the primary care nurses that you see when you can't get in to see your physician.
Right.
The nurse practitioner usually has more time available. So it's important to allow them to practice to their full scope. And the same thing goes for anesthesia. The operating room is the economic engine of every single hospital. And the anesthesia service line is one of the most expensive. So, nurse anesthetists are a better value. We are trained and educated to practice to the full scope of anesthesiology services. But unfortunately, Florida has some restrictions in their state statute that don't permit that. Whereas there are 24 other states in the country that have opted out of a physician supervision requirement. And 43 states out of 50 have no supervision language in their state statute. So Florida is one of 7 of the last, and we can't afford to be last.
Well, I'll tell you, hearing Senator Collins speak, it makes me think that it's going to be a busy session next year. So who knows what's going to happen on that scope front. Kristen, can you tell us a little bit? I've known you for many years, and I know you work very hard, but I wasn't sure that I previously knew before today that you were managing this federal grant for this program that's meant to help increase the long-term care workforce. Can you tell us a little bit about that, its origins and how it's going?
Sure. So Florida Healthcare received a grant from the Federal Centers for Medicare and Medicaid Services. We're partnering with the State Agency for Healthcare Administration to implement this. It's called the Caregivers Florida Career Program. And the goal is really to attract more certified nursing assistants into the profession. Those are really the frontline caregivers when it comes to our residents. So we've got, a couple different approaches. We're doing a very robust statewide advertising campaign, a lot of outreach and partnerships with our local career source boards. A lot of what we're doing is trying to do outreach into the schools, starting even earlier than college, but down into the middle and high schools. HOSA, Future Health Professionals, is a student chapters within our high schools and middle schools of kids that are interested in healthcare as a career. What we find often is that people don't often think about working in a nursing center. When they're going through making decisions about healthcare, they're thinking of hospitals. So we're really trying to change the narrative and educate them about these opportunities, the career paths, the opportunity for advancement, the opportunity to build these relationships in your position as a CNA or as a nurse, because many of our residents are in our care centers living out, the rest of their lives. And it's an opportunity to really have a relationship with them and become part of their family. So, the program itself, we're attracting job seekers, bringing job seekers in, and then matching them up with our nursing centers that have job openings. So that's something we've been working really hard. And again, it's helping to really open our eyes as a profession of what we need to do from a recruitment standpoint and from a retention standpoint. We're doing a lot of education to our members about retention strategies, employee recognition strategies. What does the worker of today want? They want, and younger workers, that are considering healthcare as a career. They want recognition, they want flexibility, they want a career with a purpose. And so we're trying to build experiences around that, getting our nursing centers connected with the schools that have CNA training programs to open them up as clinical training sites. So these kids can come in and really understand what an opportunity is there for them in a long-term care facility.
Thank you for that. And just as a follow, in a previous question, you had mentioned a need for not only CNAs, but licensed nurses. Your staffing ratio requirements require licensed nurses also. So does this program also encourage licensed nurses, or is it at the CNA level only?
This particular program, this federal grant, is at the CNA level, but there's sort of been an extended effect as we talk to people about what a certified nursing assistant does. Then there's a pathway, there's an opportunity to go from CNA to LPN to RN. We have a scholarship program. Many of our facilities have partnerships with schools and have scholarship programs through that. We've really been encouraged. The last 2 years, the legislature has put money in the budget for the linking industry and nursing education to really connect healthcare providers with schools, again, for a matching scholarship program. So we're trying to get our facilities connected there. So, we know we have to grow our own. And I think really, again, trying to help young adults understand what long-term care is, what a career in long-term care can be, is important. And that's part of what we're doing with this program.
Former Senator Aaron Bean used to always kind of throw out what he'd call like a lightning round question. So I have a lightning round question, if you will, for all of you before we move on maybe to some other questions. What we've spent some time here talking about some of the issues. What can be done that currently isn't being done? Like, how can we get the legislators, with the policymakers, with the influencers, with the industry leaders, with the executives to work together to try to make this, to expedite some of the solutions? Can we expedite some of these solutions? And I'll start with you, Dave.
So, I think a lot of the great answers, and there is no silver bullet, but a lot of them have been mentioned. And we've seen the idea of reducing duplicative licenses, which I've heard both my fellow panelists and Senator Collins mention earlier. We've seen that sort of focus work, wonders in both the medical device manufacturing industry, where there was sort of dual credentialing of facilities required. We've seen it work wonders in helping our trade and logistics by reducing duplicative dock permit, and dock credentials for stevedores and whatnot. The idea of increasing upskilling and really helping people move up along a career pathway has a lot of promise and will really help, I think, draw people in, especially young students, if they can see that there is a career pathway for them. But I talked a little bit a moment ago about what are things that we can do to if we have a imbalance between the supply and demand for healthcare workers, how can we affect the demand side? And so I think one thing to take a look at is the notion of health in every policy, and taking a look at when rules and regulations are made, how can health be viewed within them, or how can they be viewed through a healthcare lens? In other words, can we incentivize walking and cycling, exercise by reducing or eliminating, fees for pedestrians and cyclists to visit our state parks? Can we take a look at policies like that? And I think, it's not all on the government to help, solve the demand side of this, but, also individuals and businesses. And that's why I think, a big part of the solution is efforts like the Florida Chamber of Commerce and its leadership cabinet for health, safety, and sustainability, which is really how can we bring best practices in healthy workplaces, in safe workplaces, and sustainable workplaces to the large number of employers in the state, and 92% of our employers are less than 25 employees in the state. So they need resources like this. So I think we can attack it from both supply and demand and get some good results.
And I wonder, how much sustainable communities, are built environments around us. If I can walk to work, instead of driving in my car, I can get some steps in, I can, maybe in Tallahassee, make sure you put on some suntan lotion, but, I feel like built environments are also part of this solution, and it will be interesting to see how these new housing programs, are we going to see, developers more involved in built environments? Can you put something by a bus line? Can you put something walkable? Can you do high density?
I think a lot of the Live Local bill will get just to that, and that's the sort of development that we may see where appropriate within the communities of the state of Florida.
Right. Well, Dr. Kennelly, same question to you. What can we do, expedite some of these solutions?
I agree with Dave that, like we said before, this is a multi-pronged approach. It's not going to be any one thing that's going to solve this crisis. We have to hit it from both the supply side and, the demand side. From my standpoint, the answer is pretty simple. Just, look at our laws and look at what other states have done. We have had a temporary suspension of the CMS rules for the last 3 years to help with the pandemic. Why did we do that? We did that so that we could provide more care to more people in the time of need. And nothing bad happened during those 3 years, and now it's expired. So we have to go back to the way things were before. We've proven for 3 years that something like that works. I would encourage our policymakers, both at the state and the local levels, and even in the hospital facilities, to look at that and reduce barriers that prevent advanced practice healthcare providers from working to the full scope of their education and training.
Thank you. Always advocating. And then Kristen, same question to you. How
I-
can we make it better for long-term care facilities quicker?
Well, I think for us, the challenge is that, again, we're serving an aging population, providing 24-hour care. So, but, looking at those partnerships, again, educating young adults about the opportunities, tapping into retirees in our state or veterans. There was some legislation that passed this year that allowed for veterans to use their skills, their corpsman skills that could be transferred into, a nursing position. So those are really unique solutions, looking at what other states, how we can upskill our current employees. I think, we always look to our members to, tell us, what are some things that they're seeing in other states that are working. We care for people with Alzheimer's and dementia and other, mental health issues. Are there behavior techs that could be, another way to upskill an individual and give them more responsibilities with the proper training? So, I think there's, like Dave said, there's not a silver bullet. It's going to behoove all of us as providers to be innovative, as well as, partnering with our policymakers to come up with some solutions.
Well, I can't believe the time went by so quickly. So I'm going to thank you. I had some questions and some more questions, and we had some other questions. Sorry, we can't get to them because I want to kick this back to Dr. Bloom and Molina, but thank you all for your time. I've learned a lot, and thank you for sharing your insights with us. And I can't wait to see what's going to happen next session, as if this session wasn't busy enough. But anyway, thank you for your time. And I'm going to kick this back to Dr. Bloom. Thank you.
Thank you.
Well, I learned a lot. I appreciate the panelists and Christine. This was a very robust and interesting discussion. I think we were all coming away from it with some better understanding of the problem and some possible solutions. So thank you all very much for participating. I, on behalf of Molina, really appreciate your participating today. And thank you all.
Thank you.